it's a multi-pronged approach. And it really needs a holistic approach because there's no medications that can do this. The allopathic conventional way is not going to fix long-haul COVID. We know that already. If you go to a conventional doctor, they're going to need to dig hard into the integrative side to learn how to treat these patients.
Today's guests are on a mission to empower patients and accelerate change in the way medicine is practiced. They practice functional and integrative medicine and experienced huge improvements in their own health when they decided to switch to a whole food, plant-based diet. Dr. Micah Yu is an integrative rheumatologist, and he has a unique perspective as both a physician and a patient because he was diagnosed with gout, a form of inflammatory arthritis that's very painful, at the age of 17. Dr. Melissa Mondala is a triple specialist of family medicine, lifestyle medicine, and primary care psychiatry. She's one of the youngest lifestyle medicine fellows and has devoted decades of volunteer work in underserved communities throughout the world. With the firm belief that lifestyle medicine should be the foundation for healthcare, this dynamic duo, who are married, combined their experience and passion to open their Newport Beach private practice called Dr. Lifestyle, where they've seen patients improve and even reverse disease. So I am really excited to have these two very brilliant minds with us today. Welcome, Dr. Melissa Mondala and Dr. Micah Yu.
Thank you so much, Alexandra. It's a joy to be here. What an honor. Thank you.
Yeah, thank you so much for having us on the show.
Well, Dotsie's really sad not to be with us today, but she had technical problems. So the next time y'all come back, because I know you will, there's so much to discuss, she'll definitely be on.
Yeah, we'll be a duo together.
So I want to start off first with just a little explanation of what I teased in the beginning in the intro about your own health and how both of you actually in your younger years, I just mentioned Dr. Yu's gout, but both of you in your younger years didn't have great health. So can you share, each of you, what you dealt with and how you overcame these challenges through lifestyle? And then I really want to focus on COVID and long COVID because you two have dealt with it very much with your patients. You're experts in this area, and I think it's a very timely topic.
Mhm.
Absolutely.
Yeah, do you want to start first, Melissa, or you want me to start?
Sure.
Ladies first.
Okay, ladies first. That's how it goes. Thank you. It's interesting because going back in the day, I was a teenager, and around me, you think acne is normal. You think, well, everyone's getting it, and so I had acne and GERD, and at a young age, and even IBS, and going around, I would say. Even in my adult years, it just never went away. I thought I would grow out of it. I thought, well, I get to eat what I want, but I'm still getting sick. I'm still feeling bloated. I still run to the bathroom. It was impacting my daily life. I felt like I had to stay home in order to just be comfortable. So I knew that was not necessarily normal as I advanced in age, because it wouldn't go away. I tried different kinds of medications, you name it. And the normal traditional medications only did so much. But I knew when I went into my medical training, I was just searching for answers. And the more I searched, it was the same answer that most of my doctors were giving me. They didn't address nutrition, they didn't address my lifestyle. And that was really the big missing piece because I wasn't changing anything, and I wanted to dive deeper. And I got introduced to plant-based eating and lifestyle medicine in my family medicine resident training at Loma Linda University, where it's one of the blue zones. And over there, I was able to dig into the science and have an experience where you go to these conferences and it's an immersion, and you're wondering where's the meat, and then you realize, well, I'm not getting those meat sweats, and my skin's glowing, and I don't feel bloated. And when I was able to incorporate that consistently and turn 100% plant-based and dive in and see it for myself, it was really no turning back, because for the first time my skin cleared. I didn't have to use high-end high antibiotic doses. I didn't have to be worried about having my medications on me all the time. And I really got this surge of energy that I had more energy than my friends and family members. I was more productive. And just that was one of those igniting moments where you knew that this was the journey that you were called for. And that's how I felt, that this was for me and there was no turning back. So that's where I brought my husband along, and he was shocked that I committed and dived deep into this journey.
Yeah, so I mean, I got diagnosed with gout at age 17, like you said, but I also got diagnosed with spondyloarthritis in my 20s. So in my 20s, I started getting these weird joint pains that no one else could explain. I saw a couple of rheumatologists, and they couldn't give me any explanations. My inflammatory markers were elevated. And finally, in my late 20s, I finally got diagnosed with spondyloarthritis, which is an autoimmune arthritis. And I didn't want to take medications. I refused it. But luckily, Melissa did introduce me to lifestyle medicine. We did try some plant-based foods in the beginning. Didn't really tolerate it that well. Wasn't used to it, and then watched Forks Over Knives. And really gave this a shot. Within 3 months, my spondyloarthritis and my gout vastly improved. I went into remission. And I absolutely had no pain. My inflammatory markers went down completely. Even to this day, I don't take any medications whatsoever. I take supplements every now and then, not consistently. If I do flare, it's because I ate too much processed food, too much fried food. But day to day, I am pain-free, no stiffness, no inflammation. I feel like a new human being. I feel better than I did in high school. So this has been such a blessing. And this has really led to our passion of going to lifestyle medicine, but not only that, of digging even further beyond that into integrative and functional medicine, where really all that together is a really powerful recipe to heal patients.
Can I ask for some definitions? I heard Melissa say blue zone, so I'd like you to Melissa to define that. And would you like me to call you Dr. Mondala and Dr. Yu, or would you like me to call you Micah and Melissa? What would you prefer?
Either one, whatever's easier. Dr. Melissa is kind of my thing.
Oh,
But
you call me Dr. Micah. It's probably easier.
Got it. Okay. So if Dr. Melissa could explain what blue zones are, and then Dr. Micah, I'd like you to explain a little bit about what gout is and what you do as a rheumatologist, because I think that has to do with autoimmune diseases. That would be great. That would be terrific. So before we go further, just want to make sure everyone understands what we're talking about. So you mentioned that Loma Linda is a blue zone.
Mm-hmm. Yeah, so Loma Linda is, a blue zone. And what is the blue zones? There's, 7 around the world, and it's literally populations. So even though Loma Linda is a small city in San Bernardino County, it's actually a group of people called of the Adventist community, where just it's in their spiritual practice, where they eat majority plant-based fruits, vegetables, beans, nuts, and seeds. They spend more time outdoors, active, walking with their families in connection. And also they focus on quality sleep and avoiding toxins. And most of the toxins that most people have are smoking and alcohol. So they try to do their best to do that. And that's where they have minimal diseases, minimal chronic disease, the lowest rates of heart disease, and minimal medications. And so these people have actually lived till their hundreds. So there's documents of those civilizations living to their 100 years old, centennials. And when I was at Loma Linda, you have people teaching me spin class who are 70s and 80s, more active than me. And I said, wow, there's some secret there, because they have the key to longevity, to really this joy and this passion in their health that I've never seen before. And so that's where I know that I wanted to be part of that lifestyle of the blue zones. And of course, there's in Okinawa, Japan, and our Sardinia, Italy. There's all over the world these populations, and that's what we want to preserve and bring that back to life. So that's kind of the history behind the blue zones, and that's what we love to cultivate with our patients.
You're gonna make Newport Beach a blue zone.
Yeah, I know. It's nice and blue skies and blue waters, but we're really blessed. But we definitely want to expand it.
Excellent. And Dr. Micah, can you explain a little bit about gout? Because I've heard of it, and I heard kings got it because they ate rich foods, but I didn't really, I don't really hear about it much anymore, and maybe it's more
Mhm.
prevalent than I think because I live around a lot of healthy people who don't eat a lot of rich foods. And then a little bit about rheumatology and how that links with your the disease that you
Yes.
spondyloarthritis.
Yeah, yeah, excellent. So yeah, so gout is not an autoimmune disease, but it is an arthritis. It's a disease of the uric acid. So some patients they can't excrete enough uric acid. Some patients make too much or eat too much uric acid or foods that create uric acid. So for me, I went on a Atkins diet, which is a high protein diet back in the 90s or early 2000s. And from there, I probably weighed 150 back then, 160 pounds, and it was eating close to 200 grams of protein a day. So I overloaded my body with protein, and then usually what happens is the first sign of a gout attack is pain in the big toe. It's called podagra overnight. Your toe gets red. It feels like someone took a piece of wood and just slammed it against your toe. It can happen in other joints too, but that's classically where it goes. So if you go on Wikipedia, you'll see a picture of a rat biting a red toe. That's the classic picture of it because that's what it feels like.
Oh
Uh,
no,
it used to be,
painful.
yeah,
Ouch.
it used to be called the disease of kings, I believe, because kings would eat really rich foods, lots of meat. I think Benjamin Franklin died of gout or something close to it because gout is not only in the joints, but the uric acid can infiltrate the kidneys, so it leads to kidney failures and leads to other organs being damaged. I think Nostradamus also had gout as well. I think that's how he died also, from what I remember. You guys can look this all on Google. There's a lot of famous people that had King Henry VIII as well. Um, but when gout gets really out of control, it can lead to something called tophi, which are chalky-like substances built around joints. So if you look on Google Images, you can see gout patients have these really deformed joints with all these nodules around their joints, and it's full of chalk, like chalky like substance, because your immune system starts building up these this this substance around your joint to protect itself. So and that gets really, really complicated. But there are foods that you should be avoiding when you have gout. So they always talk about red meat. Proteins are high in purine, so that is a lot of seafood, a lot of red meats, pork, even chicken. Recently, in the past 10 years, they discovered that sugary foods such as Coke, soda, refined sugar is really bad for you. But fruit is, surprisingly okay because of the fiber. Actually there are articles in the Journal of Rheumatology talking about how fiber does help with gout because it slows down the absorption of sugars into the glucose into the bodies and the fructose. That's why fruit is okay to eat. So plant-based foods are the way to go for gout. So going vegan is is a good option.
Was this linked to your arthritis? This
Mm.
It sounds like because it gets into the joints. Was it linked?
Yes, yes, yes. So the gout was due to I mean, usually 17-year-olds don't get gout, so it was due to my food. Definitely. Do I have a genetic predisposition to it? Probably because a lot of people eat high protein diets and they're okay, but there are people that don't do okay. And as far as spondyloarthritis, I think that was question number two, is that it is an autoimmune disease. There are variations of it. If you've heard of ankylosing spondylitis, there are some celebrities out there that have it. It is an autoimmune attack of usually the lower back. The neck can be involved. The rest of the body can be involved as well. And a lot of patients have sacroiliac joint pain and inflammation. And that's where it usually likes to attack. There are usually attacks patients in the younger years, anywhere from the 20s to 40s. So patients, they have low back pain chronically. They go from doctor to doctor. No one can figure them out. They even go to orthopedic doctors. They don't get any answers. They think it's their mattress that's an issue, but really they have ankylosing spondylitis, and that's under-recognized even in the physician world. So patients need to educate themselves, be their own advocate, especially in this autoimmune disease space. So because a lot of doctors are not educated in the space enough because it's such a nebulous field, very complicated. And we only get a touch of that in medical school on knowledge. So I did have that. It didn't attack my lower back, but it attacked my face all the way down to my toes. I couldn't eat for weeks. I couldn't eat yogurt back in medical school because I would flare. It'll feel like a knot. I can open my mouth. And this would go on years on end until I found a whole food plant-based diet that fixed my problem. So I'm really lucky to be off medications, and I'm actually never starting medications.
Yeah, you were limping at one
She
point.
saw me throughout my torture.
It was hard seeing him going around the hospital. He needed a chair. His attending was nice enough to drive him to his car. It was a very, very painful experience, and it's one of those rare zebras that you don't necessarily find. And it's hard to catch in the even all different types of specialists couldn't figure it out. So yeah, we're glad to see him living life, and he lost all the weight too. And
Yeah, I
he's
lost
like,
20 to 20 pounds, 20,
so
30 pounds as well.
we both are able to just lose that inflammation, lose that weight.
Yeah, and
Oh,
it's
wow.
mhm.
You make me want to. I have one more question and then I really want to dive into COVID because can you tell, and it probably links to what we're going to discuss with COVID anyway, what were the lifestyle changes that were most important, that most helped you overcome this debilitating disease and go into remission?
For me, it was go on a plant-based diet, number one. I think that was probably the number one key here because my stress levels, I don't think, it was stressful during residency, but my stress levels are still pretty high because the nature of my job. And I don't flare because of stress. For me, the kicker was a whole food plant-based diet, really increasing the amount of vegetables as much as I can. Um, Not eating in the middle of the night every day sometimes. Exercising more consistently. I exercise. I played football in high school. I lifted weights.
You're a
Um,
marathon
I
runner.
ran marathons despite the pain. So that really didn't change. The number one thing for me was going on a plant-based diet, cutting out the meats, the processed food. Processed food number one. Like even like I would say on average, I was eating pretty healthy for the average American, but that wasn't good enough. When you have a disease, you need to go on the opposite spectrum where you need to really fight that disease with food. I was going on a seesaw. Like I would eat vegetables, and then the next day I would eat like I don't know, once a month, like couple times a week, eat some fast food, Yoshinoya or something like that, and that would just be a disaster overall. So just considering the daily habits was a big difference.
Good to know. Okay, let's dive into COVID and long COVID. Can you explain what is long COVID? How can you tell if you have it?
Yeah, we saw a lot of COVID during the pandemic, by the way. We'll kind of back it up. Obviously, we were in all sorts of urgent cares. He was in the ICU. We were seeing the surges and people coming in with their symptoms, not only just lasting, a week, 2 weeks, but when they start going into 3 weeks, 3 months, 1 year, there's an issue. You know that there's an issue deeper than the virus itself. And it's really that post-inflammatory reaction that's happened within the body. But with long haul COVID, it's been so complicated where people have been suffering from it for months and years, 2 years, where sometimes some of them would be disabled and not able to go to work or school or function. And so really that's a state of excess inflammation where the immune system is dysregulated and not able to overcome that initial infection.
Mm-hmm.
Yeah, and Micah could probably explain the exact pathway because that's his expertise.
From my perspective, long haul COVID, I think it's an autoimmune disease. Okay. There are some articles coming out that it possibly is, but in my book, it is already. It's just a matter of time before they call it. It's a chronic inflammatory condition. There are no antibodies to diagnose it. There are labs that you can get. There are labs out there that of the immune system you can get that might show some elevated inflammation. But at the end of the day, there's other things that can drive those labs up too. But a lot of patients with long haul COVID, there is a spectrum of different symptoms that you can get. Okay, so a lot of patients have brain fog, memory issues. Some patients have joint pain, joint aches. A lot of patients are getting fast heart rates, also known as tachycardia, and sometimes that can be called POTS in some populations. That's also known as postural orthostatic tachycardia syndrome, where patients have chronically elevated heart rates, and they can sometimes have panic attack anxieties from this. Some patients start getting something called mast cell activation syndrome, which we see and diagnose more and more in our clinic now. And that's under-recognized syndrome, and we can get into the weeds of that as well, where patients have severe allergic attacks over and over again due to unexplained etiology. And that's where our expertise in integrative and functional medicine kicks in. It's a new diagnosis as of 2008, so it's under-recognized and under-diagnosed in patients now. Patients can get random rashes in long haul COVID, shortness of breath, microclots in their lungs, causing shortness of breath. So I have patients in their 20s and 30s who are high functioning, doing very well, that are now barely able to walk out the house because they're so fatigued from their issues and short of breath. So there are a whole host of different symptoms of long haul COVID, and COVID itself can spark different autoimmune diseases as well. I've seen this spark rheumatoid arthritis and other diseases. So we can have a long discussion on COVID and long haul COVID today because it gets so complicated.
Yeah, literally long.
You've done a series of slideshows and webinars on the internet, and people can find them on the internet by Googling Dr. Melissa Mondala and Dr. Micah Yu, and you've done them a lot with Chef AJ. So if anybody wants to dive deeper, definitely you can find that with our two guests today. I heard you give a stat that 44% of the world's been infected with COVID. So, and 1 in 5 of those have long COVID, which I calculate that 1 in 13 of all US adults have I'm calling it long COVID instead of long haul COVID. Are they interchangeable, or am I just shortening it and I shouldn't be?
No, you're good.
It's
Yeah.
okay. It's a whole, and they call it different names, post-viral syndrome, long. Yeah, there's so many.
Okay. All right.
It's too new to give it an exact name.
Right.
You're good. You're doing great.
So can you tell, that's a lot of people. I actually have not had COVID, and I'm still trying not to have COVID. I hear a lot of people who go, oh, well, everyone's going to get it, so I don't, I might as well just get it. And I'm thinking, no, because I don't want long haul COVID. I'm really, really concerned about it. Can you tell me if you know, or if there are studies about who gets long COVID after they've had COVID? Is it the strain of the COVID, the longevity and severity of the COVID that you had? Or how healthy you work? Is there anything we know about who gets it?
When I was in the urgent care setting and there was a flood of them coming to our clinic, we always just risk stratify initially. Some people, first of all, who gets COVID itself, and usually the people who get COVID itself, and most of them are not only overweight and obese, but they have heart disease, lung disease, so asthma. They're already inflamed. They have diabetes. They have cholesterol issues. Those were 60 to 70% of people already more prone than the average population to have COVID itself. And then if you go into, there's mild, moderate, and severe complications that you can get from the COVID infection. And usually the people with more comorbidities have more severe complications and moderate also. And the post-COVID element is literally the comorbidity. So there are some people who have those that will last for a month, 2 to 3 months. And really what's hard about it is it's still not that simple, because like we said, we still see the healthy, the thinnest, teenagers still get severe COVID and post-COVID. Really, the studies are not very, very clear. I really think it's almost genetic and environmental. That's where the integrative functional medicine come in. There's the testing hasn't been that advanced to pinpoint is what is really the root cause of this long COVID. Usually it's this post-inflammatory state. They're really having, number one, poor lifestyles. Number two, there's a trigger, so they either had high stress during that time too. They were in a place where they couldn't even, for example, they had late treatment too of COVID. So when I say late treatment, they just didn't get the help. So people were getting short of breath and needing to go to the ER, but they were getting pneumonias and bronchitis. But if they were able to kind of catch their early disease sooner, and be able to have a shorter duration of their infection, they're less likely to have post-COVID. So really, it's been difficult because those people who have long infections usually have long COVID. That's what I've seen in our clinic.
Yeah,
long or lung? Like
long, just like extended times.
Yeah. Yeah, I would say, so I was working in the hospital actually during COVID. So I was working, admitting patients for COVID. I was in the tents. I would see patients. Yeah, I was in the ICU. So it was a scary time in the beginning, at least, until I got used to it. But these patients, I would see patients in the 20s, young and healthy, fit, come in with lung issues, needing the oxygen. But I would see patients, usually there is a trend, right? You have outliers, but usually the trend is more patients who are more obese, not as healthy as a lifestyle, but anyone can catch COVID and not have a great result from it. But long haul COVID, I think, is very similar in that there are similar risk factors that make someone more susceptible to long COVID. But then again, we see everyone that are bodybuilders, athletes, everyone can get some form of long haul COVID. So we think it's a combination of genetics and the environment.
And is the COVID virus still in you with long COVID? When there any way, do you see it? Or is it
Great
just
question.
inflammation?
No, great question. So our body has memory, just like our immune cells have memory. It knows when it's been exposed to a cat before. And so some people are okay with that cat experience. And other times you have an immediate reaction. But over time, sometimes you have this increased intervals of getting exposed to cats, and then you end up having a severe reaction. And so when our immune system has memory, you're going to be able to, the body will know. So for example, some patients have second, third, four COVID infections. That's what I've seen too. And each time doesn't make it better, actually. Each time their symptoms become worse and worse for some. And so it's actually not very, very simple because the immune system is so complicated. There's the autoimmune part and there's the allergy part. There's this in terms of the hypersensitivity to what's going on in the body. So it can be very, I would say, overwhelming for a patient because most of the time they think, I've had it once, it's okay, I'll get it again. And it's really, you can never predict what your immune system is doing, because if you're already stressed out, not sleeping well, not eating well, and then you have environmental toxins. So for example, there's chemicals in the air, there's chemicals in our house products or in our makeup, and just those few things can just accelerate the amount of inflammation already in the body. So it gets really complicated in that case.
Mm-hmm. Yeah, so it's first. I don't know what the studies are right at this time, whether COVID is still in the body, but let me say this. So with autoimmune diseases in general, what we do know is that bacteria and viruses can spark autoimmune diseases. So it's the same thing with COVID. You can have COVID once, you can get rid of it, but that cycle of inflammation will just spark the immune system to go off on this inflammatory cycle, this vicious inflammatory cycle that just keeps going on and on. And now we're calling that long haul COVID. That's why you have patients with all these random symptoms that are unexplainable to doctors sometimes.
Right. And it's almost similar to mono or EBV, when teenagers get that mono or that kissing disease and they have that sore throat, but they don't realize they're so fatigued for months. And they're prone, is it an allergy or is it this fatigue? And then it'll come back in their 30s and their 50s. And the body remembers that experience. And so whenever they're sleep deprived or there's a stressor in their body, the symptoms will come back again. So that's where we're seeing that clinically, and they're still trying to study once again and gather this. Even though there are so many people experiencing it in our world, it's almost unforgotten. They're like moving on to other things in science, which is sad.
Well, they don't know how to treat it at this
Yeah,
time.
right. There's no FDA approved
Yeah,
medication.
and that's where integrative and functional medicine kick in. That really
Right.
helps.
I definitely want to discuss the treatment, but I have a couple questions as a layperson about viruses. I thought, well, I get cold sores, so I know the herpes virus stays inside me and then flares if I eat chocolate or if I don't sleep or I get sun. Um, but I guess I also, does that mean that every single virus we've ever gotten stays in our body? Because I thought it was the antibodies that stay in our body. Those are the memories of the diseases. The antibodies are there to react quickly should they encounter, from the outside. Should the virus come back into the body? Have I got it wrong?
Yeah, you've got it right. So herpes virus is a little bit different. Herpes virus, what it does is once you get rid of that cold sore or whatever, it actually hides in your cells. I mean, it hides in the nerves, okay? And then, and when you get it a stressor or something happens to you again, then it can come back as shingles. So like the chicken pox, it comes back as shingles. It hides in the nerves, and then a stressor happens, and it comes back as shingles. And then it follows that one dermatome. That's why a one like linear part of your arm can start getting shingles and rashes. That's how shingles can happen with that virus. Usually with other viruses, you attack it, you fight it off, and then like you said, you develop memory cells against it. So the next time you encounter that virus again, your body just starts attacking it. So when you get labs on viruses like Epstein-Barr virus, you've had Epstein-Barr virus many, many years ago, you will always have that IgG antibody to Epstein-Barr virus always high because you've developed that memory against it, so you can fight it again once you encounter it.
Yeah, and then there's the IgM, which is an active infection, so you'll know that there's a present infection, but the virus is actually able to be cleared. That I think that was your specific question. Each
Got
time
it.
it is technically cleared out of your system. It's just the amount of the inflammation that lingers there.
But with
Eh,
long COVID, we think it hasn't cleared.
Yeah, for most people who have symptoms or who there's stressful events and they come back again, and that's once again that's the challenge because for example with herpes there's certain foods like high and low lysine that can help like
Mhm.
you can see what helps with COVID we talked about MCAS and how there's high and low histamine responses, so that's the pathway that's becoming more apparent.
Yeah, well, even if it did clear, that there's still a cycle of inflammation going on because that initial insult was there already. So your immune system has just gone crazy over like this is vicious cycle. So you could have cleared COVID, but this has developed into long haul COVID, which is a pretty much an autoimmune attack on the body.
So it sounds like inflammation that lowering inflammation is the main line of hate to use a war term, but attack from doctors like you instead of, well, if you could give a pill, give a pill, but since there are no pills, but you would always, it's an inflammatory disease.
Yes, that's correct.
So when someone comes in with you with long COVID, can you share with us some stories of patients who've come with you to you with long COVID and what you've done to help them?
Yeah.
Yeah, sure. So I had one gentleman, he was an active jiu-jitsu player, and he was someone who went in there 5 days a week and could exercise for 2 hours. But however, he did get COVID, and he came to me after seeing multiple doctors, naturopaths, chiropractors, acupuncturists, trying all the herbs, had 20 supplements, and he really felt still stuck. He had pots where he would get really, really tachycardic. He didn't know that he had that. He would sweat and he would have severe chest pain. So a lot of people, just like him, he thought he was having small heart attacks, which is the scariest thing when you exercise, or even when you're just at home, just moving. He was a father too, so when he was chasing his kids around, he would feel that sensation. So he would go to the ER a couple times, and they would work him up, get an EKG, get the labs, and everything would appear normal, but he felt horrible inside. So that was what the inflammation was doing in his body. And then how I helped him was really just that's the beauty of things, is looking at his, not only first diagnosing him with POTS and the MCAS, because you can tell every time he would get a little bit short of breath, or after eating he would feel certain foods, he would feel loose stools, and so I was able to really help him. That's where the integrative medicine comes in, with certain supplements. We went as much as plant-based as he could, so that he incorporated high antioxidant foods, staying hydrated, getting so this is a case where he needed a little bit more salt, so certain electrolytes was really helpful for him, and then really getting some medications to get him better, because with some patients, it's such a alarming state that they can't really function. So we have to add a few our compounded medications to get him out of that inflammatory cycle. And then slowly and slowly, he started to feel better. And literally within a week, he said 50% better. Within another week, 75% better. And then, by a month, he felt nearly almost better. And now he's back in jiu-jitsu months later. And that's the beauty. And I would always say, you want to be cleared by a physician to go back into exercise, because if he overexerted himself and he wasn't ready, he could easily have these symptoms come back. But it was a very amazing journey to see him get better, to see him get his life back, because he had his whole life ahead of him, but it was still very, very possible to stop this inflammation. So that was a very rewarding story.
Mm-hmm.
May I ask about a couple things about this patient? Two things. If he starts eating badly or doing some other reverting lifestyle wise, will he get long COVID back again?
Great question. There were a few times, for example, he forgot to take his electrolytes, or we call it decondition, where he overexerted himself, or he was dehydrated, and those symptoms did come back slowly. So we had to be very careful and with the medications, and make sure that not only we gave him slow amounts gradually, where his heart rate stayed down, because if one's heart rate is high all the time, that's stress to the body itself too. So we want to keep the heart rate down too, and then help that inflammation through medication. So yeah, the lifestyle was very important. So he had to maintain that, because even when he ate high processed foods or certain, I would say, oily foods, that's just more inflammation.
Mm-hmm. Yeah, and I have patients myself as well that have long haul COVID. I don't know how they choose who to see in our clinic for long haul, but we both treat long haul COVID. I see a lot of chronic fatigue in my clinic. And these patients with long haul COVID, they have chronic fatigue. So when you have chronic fatigue, you have to make sure everything else is ruled out, from the hormonal side and the autoimmune side, and then you think about on the cellular level what's going on. So a lot of chronic fatigue patients, they have mitochondrial dysfunction. So the mitochondria is a part of the cell that generates ATP, and that's ATP is needed for walking, waking up, and just functioning in life. And there's a dysfunction of that. So in my clinic, I focus on, well, what feeds the mitochondria, eating whole foods, exercising, all those things. But long haul COVID patients, sometimes they can't eat certain foods because they have a lot of food sensitivities. Even though it's healthy, they can't tolerate those foods. They can't exercise because they're so tired already. So just getting up from bed is a chore already. So what else can you do? So there are supplements that can work on the mitochondria. There are supplements for long haul COVID, for chronic fatigue. There are medications that, like Melissa said, we compound at the local pharmacy to give them the kick to get better. So it's a multi-pronged approach. And it really needs a holistic approach, because there's no medications that can do this. The allopathic conventional way is not going to fix long haul COVID. We know that already. If you go to a conventional doctor, they're going to need to dig hard into the integrative side to learn how to treat these patients.
Hey, friends and listeners of the Switch for Good podcast. Yep, that's you. I have some really exciting news. Dotsie and I have started a Switch for Good podcast Facebook group. We created it so we can build a community of fans that will help us improve the show and deliver on the topics that you want to learn more about. So we want to hear what your favorite content is, what you want more of, and what you want less of. And if you like the length of the show, Dotsie and I are always talking about the length of the show, right, Dotsie?
Yes.
We want to tailor our show around the needs and desires of our incredible listeners, almost 500,000 of you. And it's really simple to join. Just go to our Switch4Good Facebook page. That's Switch, the number 4, and then good. And then click on groups. And there we are, the Switch4Good podcast chat. You can post directly in the group, share ideas, talk to other listeners, and connect with like-minded folks. So go, run, join our Facebook group and tell us what you want. And you mentioned supplements, and I know you have talked about quercetin and low-dose naltrexone. Can you talk a little bit about the medicine and the supplements? I know that you're not telling people to take them, but just what you use and what you've seen have worked for long haul COVID, or that have worked for inflammation, because it sounds like that's the bird's eye view, is let's look at the inflammation levels and try and get those down first.
Yeah.
Is that true?
Yeah, that's true. Yeah. So how do we get that inflammation down? That's the key here. So for compound medications, like I said, low-dose naltrexone is excellent. I've had patients go on low-dose naltrexone, and with chronic fatigue, they fixed it in like 2 visits for various reasons.
What is naltrexone?
Yeah. So naltrexone is at a full dose. It's a medication that regular doctors can give. That's not compounded. You can get at a local pharmacy, where patients. It's a medication where when the patients are addicted to opioids or Vicodin or fentanyl, those medications, and your doctor wants to get you off of it and want to minimize the side effect withdrawal symptoms, then they will give you naltrexone a full dose. But low dose naltrexone is 5 to 10% of the actual dose, and they found it to be anti-inflammatory. I give it to a lot of my patients of various reasons, and it can help. It's hit or miss. Sometimes it doesn't help at all. But it's a very, I would say, low risk drug. So that's one that I've seen help my patients, sometimes miraculously. We've mentioned quercetin already. That's a mast cell stabilizer. So some patients with COVID or long haul COVID can get mast cell activation syndrome, and that's something we haven't really explored yet. We've mentioned it on this podcast. So mast cell activation syndrome is a diagnosis new as of 2007 and 2008. So your doctors may not have even heard of this diagnosis. And if they do, they don't know how to diagnose it. They don't know how to treat it. Usually the diagnosis goes to allergists, but it's such a controversial way of diagnosing it at this time, because there's 2 ways of diagnosing it. There's the one group where they say your labs are negative, you don't have the disease. And there's the other group, which I am part of, is your labs are negative, but our clinical suspicion of your symptoms are very high. So these patients can't tolerate high histamine foods. They can't tolerate a lot of foods. They're eating like 5 foods a day only, because they can't eat anything. They flare on avocados, they flare on pineapple, strawberries. It can be very, very rough. And so those patients give like antihistamines, quercetin, medications, cromolyn sodium, and these medications to help stabilize them. And there are supplements that can help with the mitochondria. There's coenzyme Q10, L-carnitine. We love NAC, glutathione to help with the antioxidation. Glutathione is one of the hottest supplements on the market these days. So that's just some of the foundations. And there's vitamin D, of course. Everyone should be taking that. You shouldn't be deficient in it, because vitamin D, when you're low on it, you get leaky gut, you get dysbiosis, and it affects there's vitamin D receptors on all the immune cells and all the vitamin D cells. I mean, all the not vitamin D cells, but all the gut cells.
Including the brain.
So omega-3 fatty acids with the algae oil. And some people take fish oil. So there's many different parts to this. It's a multi-pronged approach. If that doesn't work, we have things we do in functional medicine that can even drive that to be better. So it's different symptoms, different supplements.
Yeah, and what's rewarding is, it's usually the pathway of inflammation is very, very similar. It's this one lane that just diverges in different ways. There's psoriatic arthritis, there's long haul, there's, you know, as Micah says, ankylosing spondylitis, but it's just this pathway is still inflammation. And when we think about the supplements, yes, there's, people take zinc and quercetin. Quercetin has antihistamine properties, and zinc is great at a cellular level for wound healing, for hair, skin, nails, but also to help fight infections. And magnesium is great for your bowel movement. So, for us, a lot of people come to our clinic already. I had one patient come with our clinic with 60 supplements, and that was too much. Some people just overly get too many supplements and they don't know what it's for. And that's where I say there can be something called polypharmacy and supplements. So meaning there's maybe an excessive use of supplements if you don't know what it's for. So I'd say always get someone to kind of guide you through it, because the dosing matters, the timing matters, even how the brand, how, is it truly third party tested, and also the supplement itself, in terms of knowing, if you can't combine all of them together at once too, you have to go phase by phase. So it's really been a really great experience to help these people, because it can be almost like a black hole.
Now, I know people are listening going, oh my gosh, I want to see Dr. Mondala and Dr. Yu. I know, Dr. Yu, I think you are certified in 15 states.
Yes, I am.
Does that mean you can do telemedicine for people in all those states? Because that's
correct.
Oh, that's wonderful. And is it on your website, the 15 states?
Yes, it is. All the information is on the website.
Yeah, it's like from coast to coast.
That's fantastic. So, and Dr. Mondala, are you also able to see patients out of California?
I am. I have a couple. I have one in Florida, Oklahoma. I think we're working on Nevada. We're just constantly adding more based on the requests. So we're happy to support your journey.
Oh, yay. This is great news. Can we talk about, you mentioned the gut and you mentioned the brain. Can we talk about the link between COVID? You can tease this out for me, but I know that they're all linked. I've heard of people with long haul COVID or COVID committing suicide. And I don't know if, I'm not sure, and you can tell me, is that a random link, or is that something that has to do with inflammation of the gut, or the dysbiosis in the gut, which can make you depressed? Can you kind of talk to us about and I know, Dr. Melissa, this is your specialty. You have, you're certified in is it
Yeah, primary care psychiatry, and then also there's integrative psychiatry. So I would say that's a great question. I would have to see the study first to kind of see, because there's correlation studies out there, and it's hard to tell what came first, or if there was already existing depression or anxiety, or was it just there's also something called confounding factors or variables in studies where it just happened to be in that cohort where they saw that increased risk of that statistic. But I would still say there's a significant gut-brain immune connection. That's what we do in our clinic all the time, because when your immune system's in your gut, that's, you have your one cell layer thin of your immune system there, that's very vulnerable to not only what we eat, but also our stress hormones, our nervous system. 70 to 90% of serotonin and dopamine are in your gut. So whatever you're feeling, it's like your second brain. It's gonna feel, if you're eating inflammatory foods, if you're experiencing a virus, your gut's gonna be inflamed. But also there's a direct connection to your brain itself. And so whenever there's inflammation or viruses that cross the blood-brain barrier, you have the immune system kicking up, called the glia cells, and you're going to go in there and really cause this post-inflammatory effect. So there are studies not only with COVID and post-COVID, but also lupus and RA. We just did this talk with Chef AJ, that 20 to 30% of them have depression and anxiety, but also something called psychosis. And this is where the realm of psychosis is when they're not feeling themselves, or they see and hear things that may not be real, or they have increased rates of suicide. So that is very, very real. And when we think about it already at baseline, 50 they're saying now 50 to 70% of people have already depression and anxiety. It's going to be the number two reasons why people are disabled by 2025. And it's the statistics are climbing. It's the second most common reason why people commit suicide is because of depression and anxiety. And it's a number two killer of, especially from their teens to up to their 30s, of being suicide itself. So you're just going to see high amounts of depression, anxiety, suicide, not only at baseline, but those who experience COVID and post-COVID because of the post-inflammatory reaction in their brain. And there are those cases where we've seen and heard where they have such severe long COVID. They are so fatigued, they're so overwhelmed that they just don't feel like living again. And even with our autoimmune patients, they are on the risk of wanting to commit suicide. They already are actively thinking of it, but they just don't have a plan. And that's where I come in and just make sure that they have the mental health support through lifestyle, sometimes medications, and frequent follow up.
What are the top three things you would recommend for someone to help their gut keep it as healthy as possible? And therefore it could help with other things like inflammation, which you've been talking about, and mental health, and et cetera. We're starting to see how important a healthy gut is.
Yeah, no, that's our favorite question on the brighter note, right? Fruits, vegetables, all that high fiber food is going to be number one. So high fiber food from fruits, vegetables, those berries, those omega-3s come from flax seeds, chia seeds, walnuts. Those are wonderful. And then the third is really, you also want to have a good amount of healthy protein. You still want your beans and your legumes, your edamame. All of those are very helpful, not just to keep our body sustainable and feeling full, but you need that to fuel your energy as well. That actually makes up all the DNA. We need protein, healthy protein, to make up your DNA, help with the damage that may be happening in your gut or even in your skin, because that makes new cells, new DNA. So whenever you're able to have a nice amount of healthy plant-based fiber, plant-based protein, but also plant-based omega-3.
Great. Dr. Yu, do you have anything that you recommend outside of those? I mean, I know there are a lot more things.
Yeah. So avoiding environmental toxins is number one for me, besides food. I mean, we can't avoid pollution. It's very hard, but at least getting air purifier at home. Avoiding plastics. Get rid of those synthetic air fresheners. Those are just some of the things for the environmental toxins. Probably get clean water as well. Getting a good night's sleep is really important. When you have poor sleep, that leads to gut dysbiosis as well. And making sure you exercise, even if you can't lift weights or run, just doing yoga, stretching in bed, if that's the only thing you can do, that's a good start already. Or Tai Chi is really good.
Great. Thank you. Now, you mentioned, Dr. Micah, that way in the beginning when you were talking about working in the hospital, that one of the things that helped you was not eating in the middle of the night, which made me think of fasting and intermittent fasting. I wondered exactly what you were talking about when you mentioned that. But can you tell us, does fasting or intermittent fasting help us with inflammation and thereby maybe with long COVID? Any news on that?
Yeah, I don't know what the data looks like with fasting and long haul COVID. I doubt there's anything out there at this time, but maybe I'm wrong. But eating in the middle of the night can affect your circadian rhythm, and it can lead to more inflammation because your immune system releases certain chemicals at certain times of the night automatically. So if you're staying up late, you're eating late, that'll disrupt your bowel rhythm and your circadian rhythm and lead to gut dysbiosis that way. As far as fasting helping inflammation, it does help with inflammation. There are fasting centers in the US. I tell my patients to fast a minimum of 12 hours. That means simply eating 7 p.m. at your last meal. First meal next day is 7 a.m. I know if I do flare, I fast myself for a full day and it goes away the next day. Same thing happens with my other patients. They fast for a full day, their joint pain, whatever, goes away the next day. Now, other people, they're not as lucky. Okay, maybe they fast for a full day and their inflammation is still very, very rough on them. So it's not one size fits all here. And some people, when they fast, they feel a lot crappier. And that can happen as well. Some people aren't ready for fasting. Some people have eating disorders. They're not meant to fast. So everyone's a little bit different.
Okay, but the fasting has helped with lowering inflammation in a lot of people's way.
Yeah,
Yes, it definitely has.
exactly.
Yes.
Through the
Okay.
mTOR enzyme, and it's anti-aging.
Yes,
We
anti-aging.
love intermittent fasting because it helps decrease the spikes of insulin, and that's really the insulin drives inflammation too. That's the reason why we have more diabetes, cholesterol, obesity, even PCOS, even menopausal symptoms are all linked to those high insulin levels.
We're all for intermittent fasting.
Great. I just a couple more questions before we go, because I know you have a really busy practice. And it's going to get busier after this show.
Thank you.
I heard that people often think that COVID is a respiratory issue mainly, but a doctor that I was listening to in preparation to understand more about long haul COVID mentioned that it was very much had to do with the arteries and veins and things. That it really affected those, and there we hear about blood clots and things. And I did hear you, I think it was Dr. Mondala, say that blood thinners, that you put people on blood thinners to help avoid long COVID in the first place. Did I mishear that?
Yeah, that's always a great option, because whenever we're in a post-inflammatory state, the blood gets more sticky, and there's something called fibrin, and there's certain markers that we get, and even genetics that you can look at some people don't even know that they have an increased density to get microclots. So it's important to, turmeric is also wonderful, or if to just have at certain doses, and then I do say aspirin too, because it's just aspirin is such a safe medication with minimal side effects that you can take it short term. That you can minimize those clots. And so I think it's important to thin out the blood, because we see in our patients that increase, it stays there. There's just, some people have glutens or extra, basically the stickiness, these extra proteins and chemicals. I'm trying to just make it very simple, so that the blood gets thicker. So whenever blood is thicker, that's stagnation. So if it's slow, that's increases the risk for clotting, and that's when people start feeling they're not getting enough oxygen to the brain, so they get brain fog. They're feeling their breathing is slower. They can't take that deep breath, and then overall they feel fatigue, and once again they'll have other symptoms. Maybe they're feeling cold or whatnot. There's a whole host of I would say therapies that we can try to help prevent that, and also support that through long COVID.
Now, this is for people who have, are you recommending that people go on blood thinners to avoid having bad symptoms of COVID and then long COVID, or just are these for people who've had COVID or are having COVID when they come to you?
Yeah, I would say they would have, of course, make an appointment with me to really tease out what the risks are and everything. Usually, I have to confirm through testing. I have to also confirm through their history what's best. So that's why I don't like to give specific medical recommendations. But it is, turmeric is probably the safest thing.
Got it. So turmeric's just good anyway, but are there other things that we can do to prevent long COVID if we get COVID, and we know we don't want to get long COVID? What would you recommend, that 3 top things that they do while they're dealing with COVID?
Yeah, make sure vitamin D levels are appropriate. Low vitamin D levels is a risk factor for a lot of different autoimmune diseases and leads to more inflammation. Eating a proper diet while you have COVID, or just in general, because if you keep eating these ultra processed food, fried foods, you're just adding fuel to the inflammation. And just make sure you don't overwork yourself while you have COVID. Make sure you rest, because you need to recover. You need that immune system to stay strong. So those are the some of the simple things, top 3 simple things I would recommend to patients. And after that, it's really individualized per patient in our clinic. There are ways to fix long haul COVID, but it takes a lot of work, a lot of one-on-one testing and education on patients and supplements.
Well, thank you both so much. And our audience can go to drlifestyle.org to book an appointment with Dr. Mondala or Dr. Yu. And remember that if you're in those states, those many, many states that that might not be California, in which they are also able to treat you as a patient, then you could have telemedicine appointment with Dr. Mondala and Dr. Yu. So fantastic. I'm excited for all the people who now have some hope after dealing with things like long haul COVID or inflammatory diseases and autoimmune diseases. So thank you so much for being on the show today.
Thank you so much. Yeah, go ahead, Melissa.
No, it's a joy. And I know it can be complex, but it's really something that we can support you with. I think it's a joy to just be able to educate and bring out these tough questions.
Yeah, in our clinic, we don't give up hope on our patients. We give hope. We search for answers, whether it's traditional, alternative. We offer all those to our patients to really fix patients, reverse diseases, and hopefully fix this long haul COVID that a lot of people are experiencing.
Anything else you want to share with our audience about how they can learn more about you and your work?
You guys can find me, My Autoimmune MD, on Instagram, TikTok, YouTube. myautoimmunemd.com is my website, and Melissa has her own website as well.
Yeah, so right now it's melissamondalaMD.com, or you can go on Instagram, Dr. Melissa's Kitchen. So I'm always in the kitchen creating yummy recipes to make it enjoyable, tasty, and something my patients love it because they're able to have just 5 ingredients and have a recipe that they can share for their whole family. So I have that on my Instagram. I have a YouTube to kind of walk you through all the specific nutrients of each I would say ingredient I put in my food, and it's been a lot of fun. We kind of really make this a place of learning, healing, interacting, because it's a lifelong journey and we live it out ourselves. And so we love supporting people who are just even curious.
But it might be changed to Dr. Melissa Mondala, your handle.
Oh yeah, maybe in the future. So stay tuned. You can ask around and dig it up for those.
Just go to our clinic website.
drlifestyle.org. You can definitely find both of them. Okay, great. Thank you so much for being on the show.
Hey, folks. Okay, back by very popular demand is our plant-powered plate fridge magnet, which you are going to receive for free if you leave us a rating and a review on whatever platform you're listening to this podcast on. So here are the details. Just write your quick review. Does not need to be long, does not need to be a whole story. Just be honest and speak from the heart. Then take a quick screenshot of the review you wrote and email it to us at podcast@switch4good.org. That's podcast@switch4good.org. And include your mailing address so we can send you a power plate. We are doing this because the more reviews we garner, the higher we go in search results, which means more folks will learn about our podcast. So the power is in your hands. Leave us a review and zoom, your power plate arrives at your doorstep.
So thank you so much for tuning in today. If we helped you in any way, then click the subscribe button and let's keep hanging out together. We have so much more to share with you.
And if you need more information on actually making the switch for good, please visit us at switch4good.org for loads of info. And you can subscribe to our mailing list where you will receive all sorts of super cool gifts, discount codes to our very fave dairy-free products, and a lifetime of powerful health tips.
So join us on the journey to switch for good. This is the future.